Hello everyone, our group is here to discuss the subject of cancer care in Western medicine. Today we have Claudia, a charge nurse at St. Jude at the Infusion Center, to answer some questions about Western medicine and understanding how holistic methods complement traditional cancer care today. I'm Krista Sai, a fourth-year biological sciences student at UC Irvine. To start off, we wanted to hear a little more about you, if you wanted to introduce some facts about yourself.
Hi. Hello, everyone. Thank you for providing this invitation, open invitation to me. My name is Claudia Flores. I am the clinical lead supervisor for an outpatient infusion center through St. Jude Medical Center. I have been an oncology nurse for the past 17 years. Very proud to be a part of this organization, which is magnet recognized, and we also have a distinction in magnet recognition, which is it's an honor to have that that accolade. We are also stroke certified, our facility. We have a wonderful cancer program through our organization. I have a passion for oncology since I started as a nurse, and it's what I live and breathe every day. And I'm very proud to be a part of this very fast-paced, growing care, especially for cancer, since cancer is booming and there's so much research that we are doing at our outpatient facility. We have cutting-edge technology right now, especially through our radiation oncology department. So I'm very emotional. I get very passionate about this subject.
Great, thank you, Claudia. It's great to have you here today. To start off our interview, we have a general question about cancer care, which is, what are your thoughts on Western medicine and non-traditional medicine in cancer care and the effectiveness of both treatments?
Okay. Well, first of all, Western would include the aspects of surgery, chemotherapy, radiation, also in combination with targeted drug therapy. And these are all therapies to manage much of the side effects. The goal is to treat the whole person using evidence-based practices. The non-traditional form is complementary medication, which would include standard care, which would be chemotherapy, immunotherapy, and radiation. This also manages the symptoms. One more thing I wanted to bring up is under the non-traditional is also the alternative medicine. It's strongly discouraged by healthcare professionals as it can increase risk of deaths by delaying proven care. So that's a big challenge that comes into play with the non-traditional.
Yes, thank you for that input. We have discussed things like this in class, the chemotherapy, the radiation. I'm Natalie. I'm a junior level student at UC Irvine. In one of our readings, the use of acupuncture and herbal treatments was mentioned as a therapy or cure to some cancers. Can you give a personal experience you've encountered of a patient that has either rejected Western medicine care or has tried to tell you about other non-traditional cures that they've tried for themselves, and how if it has impacted their treatment?
Yes. I can clearly remember a patient. She was Indian culture, and her belief was their practice that they do. I forget the name of what practice that they do. They have a specific rituals that they do, and it includes like herbals and spiritual leaders. And she was diagnosed with stage 4 breast cancer. This patient opted to not get any kind of treatment, and she was at a stage 4 already. So our purpose was to give her the treatment to alleviate her pain. And, it was more a palliative measure, which would mean that we were treating her cancer to alleviate discomfort. She opted to not receive the treatment, and within 1 month, it was very unfortunate that she declined very rapidly. She went through a lot of pain, a lot of the side effects that she had it was very devastating for her family. So after, she was hospitalized before she passed. Her family came to our infusion center and they expressed how they really regret that they did not go through with the treatment and how detrimental it was for the family, that they saw a different perspective of Western medicine, which is, the chemotherapy, radiation to alleviate the cancer that was growing inside of her symptoms. So that was a very humbling experience, and it really opened my eyes of how the culture and their beliefs impacts a big part of the decision making that they make. And sometimes it's very important that we provide as much education to the families. And honestly, I think a lot of it comes from the nurses. I mean, the oncologists, they give the diagnosis and they give the plan, which is a very scary thing for the patient. But in the end, it is the nurse's responsibility to really provide really go into details of what the options are and the how those options will impact their everyday and how it will help them, to get through those side effects that are manageable, because a lot of it is manageable. But if the patient, there's language barriers or cultural beliefs, if they don't understand the reality of what options are available, it's very difficult for them to make a decision, especially when they're diagnosed with the cancer. So I strongly believe that that was my one experience with a patient that I could clearly remember.
Thank you so much. And yeah, it's very important to understand how exactly patients view their cancer and treatments of it. And I wanted to ask, by the way, I'm Nate. I'm a senior level student at UC Irvine as well. And I wanted to tie in relation to one of the same readings that Natalie talked about. We've seen applications of both holistic and herbal medicines alongside Western Orthodox medical treatments for cancer with varying forms of effectiveness. And so I wanted to ask if you have any sort of opinion on why holistic forms of medicine aren't offered in formal hospital settings or covered by insurance. And do you think that there's a reason why chemotherapy and other forms of like immunotherapy and surgery are the primary forms of treatment?
Well, for holistic care in the hospital settings, I'm speaking from my own experience. We do offer holistic care in our hospital settings, and we have a great team of palliative care that we work with in inpatient. They are very supportive to our patients, providing the goal of enhancing the well-being and improving the patient outcomes. It mainly increases patient satisfaction. That is the main thing, and it helps the patients make decisions. They're often effective with chemotherapy, all of that, because it works best in combination, because it becomes targeted. It becomes a targeted treatment with chemotherapy. Directly, it kills their cancer cells, while the immunotherapy trains the immune system to recognize, and it destroys the cancer, heading for the treatment goal. The goal of the treatment is to shrink the tumor quickly, and the goal of the immunotherapy is it creates a response against the cancer cell. Also, there's a lot of research out there that's proven that combining them is more effective, as chemo can make them more vulnerable to the immune system. So I strongly believe that encouraging the holistic care is a combination with chemo and immunotherapy and radiation, and allowing the patients to become a part of the decision making and incorporating their beliefs also, especially with culture and what their beliefs is in their the well-being, is a big part of the healing and decision making for the patient.
Thank you so much, Claudia, for your answer. That was really awesome to hear that perspective. My name's Rayla. Can you hear me?
Yes, I can hear you.
Awesome.
Yes.
So in our readings, from what we've learned in this class, we've seen some patients that reject Western medicine say that they feel rejected by society and that they feel really ostracized by their community, and they feel like they're kind of just not as much accepted for their choice. How do you feel about this, and do you feel like in the professional setting, patients are all treated with the same dignity and empathy, no matter which treatment plan that they choose?
Oh, that's a good question. That's a very good question. Oh, from my experience in interacting with a lot of different types of patients and different diagnoses of cancer, because there's all sorts of cancer diagnoses, there does tend to be some, I would say, some discrimination, especially I think the big thing is in the work environment. From my interactions with the patients, when they speak about their own experiences, there does seem to be a lot of discrimination, sometimes in the work setting, their jobs, because they end up, being downgraded in their positions, or a lot of people are afraid of hearing that word, oh, they have cancer, and they think, oh, now they can't do this. Now they're not competent in doing that. And I'm telling you from my own experience of listening to what patients share with me, there is a lot of discrimination, especially in the work environment. In our outpatient healthcare setting and us treating our patients, I find that we work collaboratively with our oncologists, with our palliative care nurses, our social workers, and our navigators. We have a great team of navigators. They're very involved collaboratively with the infusion nurses in making sure that our patients have the resources, the support that they need, especially when they're going through this journey, which is a very long journey for some of our patients. And they're our go-to. So it takes a village for all to be able to support our patients, especially with that diagnosis of cancer. So I think that in reality, we support our patients 100%, and I feel that a lot of the times, a lot of the survivors, which is the ones that finish their treatment, they have a survivorship program also through our cancer center. There's a survivorship program which meets every week, and they have a lot of activities that helps them to engage in the transition after their treatment, like how to cope with life, how to cope with the side effects, the secondary side effects that are long-term, especially with a lot of these regimens. So I feel that we have a great support system, and we use a holistic approach. A lot of the times there is the combination of the holistic approach also that we use in combination to provide the support to these patients.
Okay, I'm Andrew, an anthropology student at UC Irvine. Building on what you already shared, I want to ask something more future focused. Do you think hospital will eventually integrate more holistic approaches like emotional support, more cultural healing practices, and stress reduction therapies into standard cancer treatment? And what barriers do you see that make this difficult today, like bias or discrimination or that kind of stuff?
I believe that in the future, there will be a cure for cancer. There is so much research that we are doing in an outpatient setting that is buying our patients a lot of time and it's giving them hope. I believe that the holistic ways with the chemotherapy, immunotherapy, radiation is one type of treatment modality that needs to be used in conjunction with the holistic approach. It cannot just be a holistic approach in order to reach a goal of treating our patients. Do I believe we'll be cancer free? I believe we will in the future, especially with every day looking at the list of all the FDA approvals of new medications, being oral, immunotherapy, chemotherapy. There is tons of medications every day coming out. If you know, I'm included in an organization where it's a research team, and it's amazing how the list is getting longer and longer, and they're starting to combine a lot of secondary, tertiary treatments and facilitating these treatments into the plan to help alleviate a lot of the cancers, making the progression of the treatment, it's improving the progression of the treatment. They are seeing a lot of better results in PET scans, especially after treatment, that are shrinking the tumors, that are targeting the tumor. And that's what I see a lot of right now in the years to come. So I see a lot of promising future for cancer patients, cancer survivors. And it's just something that's going to be booming. It's growing every second. So I do believe strongly that there will be a cure for cancer.
Thank you so much, Claudia, for taking the time to speak with us today. Your insight helped us understand not only the clinical side of cancer care, but also the emotional, cultural, and holistic dimensions that shape patients' experiences.
As a group, we learned that Western medicine provides the foundation for effective cancer treatment, but holistic approaches can support emotional well-being and help patients cope throughout the process. We also saw how integrative models are slowly emerging and that the future of cancer care might depend on balancing medical evidence with human-centered support. Thank you again for your time, and thank you to everyone listening.